Uh, Ultimately, this is all about individuals, people's health. And I had a Medicaid event in my state a little while ago, and we had 4 or 5 people talk. One of them named Brandon. Brandon was born 15 weeks early. He weighed weighed about a pound and a half, and he was taken to the Mayo Clinic. He was born in the Twin Cities, and Mayo said, we can't handle him. We can't save his life. And they sent him back to Minneapolis to Gillette Children's Hospital, where they did save his life. And his parents were told the first day is going to be about $1 million. And he was born with hydrocephalus. He had water in his brain. He cerebral palsy. He spoke at this event. He's 17. I actually don't worry about him because this is one of the most resilient kids I've ever met. But he wouldn't be here without Medicaid. He had a walker. He has gotten 37 surgeries since he was born. And all of this is because of Medicaid. And what Bob Casey is true. This isn't protecting these kids. This is going to be cutting Medicaid for everyone, and states will have to figure out what they're going to do with it. And there are going to be kids with disabilities who are hurt. I met today with school administrators from Minnesota who are extremely worried about this because so many kids in their schools receive health care and help through Medicaid in their schools, including mental health. This will be devastating. And I don't think this is going to pass. I've been around the state. I'm co-chair of the Rural Health Caucus in the Senate. In Perham, Minnesota, a rural area that I'm sure went for Trump. I didn't look at the numbers, but I know my state well enough. There was a woman at this round table who was crying because her mother receives home health care. And she said, if this goes through, she'll lose that. That's through Medicaid. And both my husband and I work, and we don't know what we're going to do with my mom. This is a cruel, cruel bill. And the Cruz bill, what that does is, for very healthy people, they'll be able to buy a cheaper plan. Insurance companies will be able to write these junk policies. Some of them will be health savings accounts, and it'll be catastrophic. It'll work for them. But, man, what this does for people with pre-existing conditions, we're right back where we started. Gene is right. Every one of my colleagues is right. Once the Republicans get done with this, I hope they can come and work with us, work together to strengthen the exchanges, which we can do the way Gene was talking about, and then address the high cost of pharmaceutical drugs. I have a comprehensive bill to do that. That's what we should be doing. That's what we should have been doing all along.
Thank you. Wow.